Hi everybody, it's me, Dr. William Hatton, and welcome to my 5-day knee pain management class at home. Let's get started. In each class, we're going to discuss the anatomy of the knee, and we're going to talk about some selected topics for that day. For today's class, we're going to talk about chronic versus acute pain, using heat or ice to treat a problem, the common causes of pain, whether or not to exercise or rest an injury, and when you should go to the doctor. Now, the knee is the largest joint in the body. It connects the thigh and the shin, and there are a lot of moving pieces, a lot of really big ligaments, some of the thickest parts of bone that we have in the body, as well as muscles, nerve, cartilage, and all sorts of other fun stuff. Now, the knee is what we call a hinge joint, and its primary function is to bend and straighten. It's capable of moving, twisting, and having some other function, but that's not really what it's for. That's not really how we use it, and it's most impacted by standing, walking, and running. Pain can be either chronic or acute. Acute pain means that regardless of how you experience the pain, it has not lasted more than 6 weeks. So it's a relatively new experience. Chronic pain, again, regardless of how you experience it, means that you have been dealing with that type of pain for at least 6 weeks or more. Now, if you've wondered whether or not you should use heat or ice to treat an injury, here's a handy table that explains how they work and can help you decide. For most new injuries, anything under 72 hours since the injury, I am going to recommend that you use ice. It reduces swelling, it reduces mobility in the area, and it helps reduce pain, and that's generally going to be good to help prevent further injury to that area in that first 72-hour period. Now, once you've passed the 3-day mark, you are really able to use whatever feels best for you, heat or ice. Heat is going to bring more blood flow, it will increase local inflammation, and it's going to increase flexibility and movement in the area while reducing muscle spasms and reducing pain. Ice is going to reduce blood flow, thereby reducing local inflammation, reduce swelling, and reduce that flexibility and movement in that area. We're going to be kind of slowing things down. It also helps relieve pain. So, under 3 days, I want you to use ice. Beyond 3 days, use whatever feels best and helps you best accomplish your goals. There are 3 common causes of knee pain. The first that we're going to see is overuse or degeneration. So, this is going to be somebody that has stood or has walked or has worked on their feet all the time. They might experience overuse or degenerative knee pain. We'll also see sports injuries. We most commonly see those in ligament tears, so ACL, MCL, or meniscal tears. There are also trauma-induced injuries that obviously could come from sports, but could come from a slip and fall or any kind of other accident. These are common with strains and sprains, fractures, and dislocations. A lot of people want to know whether or not you should exercise or rest an injury. Some people will even tell you, oh, just walk it off and you'll feel better tomorrow. I think if you have experienced an injury and it is less than 3 days or 72 hours old, you should probably rest it to be safe. That gives you the best chance to avoid further injury or avoid aggravating what you've already done. Now, if the injury is more than 72 hours old, it is probably time to start giving it some kind of gentle exercise. If you're looking at something coming from chronic pain, for which exercise is one of the best medicines, you definitely want to get movement into that area. It is often as or perhaps even more effective than drugs or surgical management for pain. Now, let's talk about when to see a doctor and what kind of doctor to see. If you experience any major trauma, if you feel a loud snap or a loud pop when you experience an injury, those are definitely signs to get to an emergency room as fast as possible. If there's not an emergency room located near you, you can try an urgent care, but especially when we're talking about knees, it definitely might be worth getting an x-ray. If you are experiencing milder to moderate symptoms and if the pain is chronic, that's a great time to try a chiropractor for your first visit. We're experienced with extremities, which are joints outside the spine, and we can often help alleviate many of the common causes of knee pain. You can also try some home exercises like the ones that we're going to teach you in this free course and see if they help alleviate some of your pain. Thanks so much for stopping by, and I hope that you tune in tomorrow for our next knee pain management class.